Hi, I'm Dr. Brian Thomason, currently in my 19th year of practice as a state board certified doctor of chiropractic. I'm board certified in integrative medicine. I hold certification in functional neurology and have more than 600 hours of advanced study in the area of clinical nutrition and blood chemistry analysis combined. If you're watching this video, it's likely that you or someone that you love or care about is suffering with a thyroid problem. The information that you're about to hear is most likely nothing that you've heard before and should greatly expand your understanding of your thyroid health and its function. You will most likely learn more in the next 20 to 30 minutes about how your thyroid functions than you have in your entire lifetime. Now, the truth about your thyroid is that it directly affects and influences every single cell and organ in your body, which means that your thyroid also is affected by every cell and organ within your body. Now, you may not recognize how fundamentally important what I just described to you is, so I'll take a little time to explain the importance of it, because if you're like most people who suffer with low thyroid symptoms in the United States, you've only looked at solutions within your HMO/PPO environment of care, have only ever been offered a pharmaceutical solution, and you've probably been left with the impression that your thyroid is an isolated, separate gland that functions independently from the rest of your body, and your only choice is to take thyroid hormone for the rest of your life. Well, as I stated before, your thyroid affects every cell and organ within your body. Now, this is verifiable through textbooks on physiology and research, but one area where this will be obvious to you is in how diverse and seemingly unrelated thyroid symptoms can be in a person who suffers with them. With your thyroid problem, maybe you're experiencing fatigue. Maybe you're experiencing weight gain despite being on a low-calorie diet. Maybe you experience morning headaches that wear off as the day progresses. Or maybe depression, diarrhea, constipation. Maybe you have a hypersensitivity to cold weather or poor circulation or numbness in your hands and your feet. Maybe you experience muscle cramps or increased susceptibility to colds and other viral or bacterial infections and have a difficult time recovering from them. Maybe you experience slow wound healing or the need for excessive amounts of sleep just to function throughout your day. Maybe you have chronic digestive conditions such as low stomach acid, dry, itchy skin, or maybe your hair is falling out. Maybe you've noticed that you've lost or are losing the outer 1/3 of your eyebrows. Maybe you have dry skin or swelling. Now, did you notice how diverse those symptoms are? They're literally all over the place, indicating problems virtually in every system of the body. Again, what this diversity shows is how interconnected your thyroid function is with the rest of your body and systems and organs. And the care that you've been through up to this point doesn't even come close to addressing that fact. Now, the first thing I'll say about today's standard of care within an insurance environment is that it is the same protocol introduced in the 1960s. It's over 50 years old. Testing is dangerously shallow and superficial, and the protocol that you've most likely gone through up to this point now does not reflect today's current level of research on thyroid disease. This HMO/PPO standard of care begins with you having one, some, or many of the symptoms I previously mentioned. You present to your primary doctor because you know something's out of balance and these symptoms tell you something's wrong, and a resulting blood lab is ordered. Now, when a blood lab is ordered by a doctor within the insurance environment, you're most likely going to get only one marker telling you anything about your thyroid function. This is, of course, TSH, or thyroid stimulating hormone. Now, thyroid stimulating hormone is secreted by your pituitary gland, and that stimulates your thyroid gland to produce your thyroid hormones, which are T3 and T4. Occasionally, an additional thyroid marker will be included in your test, like T4, but even this addition gives relatively useless information in order to understand and determine what the underlying cause of your thyroid problem is. If your TSH results came back high, you were diagnosed with low thyroid, given virtually no explanation as to why, and no further testing was done before you were prescribed Synthroid, Levoxil, Cytomel, or Armour. You were then told you would need to be on thyroid hormone for the remainder of your life and return periodically to check your TSH levels in order to adjust your medication. In the case where TSH levels were not elevated, you were told you don't have a thyroid problem and no further exploration into any other area of your health is made. Or quite often, medications are prescribed for each of the individual symptoms you're experiencing, an antidepressant for depression, for example. And before you know it, a patient who went in for a thyroid issue finds themselves taking a slew of medication, one medication for one symptom. And the underlying cause at this point still hasn't even been addressed. So what I was just describing to you is the current standard of care, medically speaking that is. Symptoms, 1 or 2 tests, diagnosis, thyroid hormone for life. That's it. That is the most common experience a person in the United States with low thyroid has, and obviously there are problems with this protocol. First, it's only testing for one mechanism of thyroid dysfunction. There are well over 24 different mechanisms and 6 different patterns which can cause thyroid dysfunction, and all of them are recognized and published in current scientific literature. This approach does not reflect our current understanding of why someone develops a thyroid problem. Second, it's a 50-year-old protocol which was created in the 1960s, and it assumes that everyone with low thyroid has low thyroid for the same reason. Well, published research tells us that not everyone is low thyroid for the same reason. And third, it clearly and completely ignores the most common cause for low thyroid in the United States, which happens to be an autoimmune disease. Ignoring this autoimmune disease, which is the cause of 90% of thyroid problems, is dangerous. And I'll discuss that a little bit later in the information. So with this approach, it's pretty clear that what's being treated is your diagnosis and not you as a unique individual. And if treating the diagnosis was effective, you wouldn't be watching this video searching for solutions. The reason you are watching this video is because what has been done for you medically thus far has failed at some level. So the question becomes, what is the solution? Well, there's an entirely different approach that should make a lot more sense to you, and it starts with the understanding that there are multiple reasons for a person to be low thyroid, and that adequate testing must be done in order to understand the underlying cause of your thyroid problem. It's called a functional approach, and if you ever hope to gain control of your thyroid problem, you need to understand this perspective. And then, of course, beyond understanding, you need to act on this information. If you want to get different results, you need to take different actions. Otherwise, nothing changes. You've most likely been searching for a solution which does not exist within the insurance environment of healthcare. A functional approach includes looking at a person's health from 3 different perspectives. They are metabolic, neurologic, and structural. Now, before I go over metabolic testing, I'd like to quickly review a few points so that they're fresh in your mind. There are over 24 different mechanisms that can cause low thyroid. There are 6 different patterns of low thyroid, which have all been published. Today's standard testing protocol, medically speaking, can only identify one of those patterns and is specific to none of the over 24 mechanisms. And not everybody is low thyroid for the same reasons. When I explain this to patients, the most common questions that I get asked are these. Are there tests that can help identify which of the 6 thyroid patterns a person is in? And the answer to that question is yes. Are there tests to help identify which of the 24 mechanisms might be causing a low thyroid condition? Again, the answer is yes. And why are these tests not ordered as a routine part of today's medical protocol? And although the full answer to this question is beyond the scope of this video, let me just give you this perspective. I think that most of us are under the impression that practicing doctors have a level of freedom to implement whatever protocols they believe to be in the best interest of their patients. These are things based on scientific literature and clinical results. And it was definitely more like that decades ago, but I will tell you that doctors who practice within today's insurance environment of care, they have virtually no choice but to follow pre-established protocols that have been and continue to be cut, pruned, and manicured by insurance administrators. These are non-doctors who have primarily a financial or profit-based objective. It is not the objective of your health insurance company to return you to an optimum level of health. If this has been your expectation, you're most likely frustrated by the fact that no one is even attempting to get to the cause of your problem. Another way to answer this question is, even if they did order this level of testing, this deeper level of testing, the care that you would receive within the HMO PPO environment, it wouldn't change. Now, the thyroid is made to be very sensitive and responds to even the slightest change in body chemistry. The thyroid has an effect on and is affected by every cell, organ, and system in the body. Its job is to detect subtle shifts in body chemistry and metabolism and compensate for these shifts. When these shifts become out of balance, chronic, and repetitive, the thyroid fatigues and falters. The following are several triggers that can create thyroid imbalance that you may not be aware of. Blood sugar that's too high or too low. This is also known as dysglycemia. Insulin resistance or metabolic syndrome, which you may have heard or referred to as prediabetes. Non-alcoholic fatty liver disease or fatty liver, which is now epidemic, conservatively estimated to be present in 30% of the US population. So that's liver congestion and liver toxicity. Brain imbalances or brain misfiring, and I'll get to more of that when I describe functional neurology. Chronic inflammation, unhealthy intestinal flora, which is also known as dysbiosis. Hormone imbalances, adrenal gland dysfunction, the use of hormone creams or pills, occult infections, which are usually harbored in the gut. Every cell in your body has thyroid receptors. That's how widely used your thyroid hormone is. These systems are bone metabolism, your immune system, your brain and nervous system, your memory, your cognition, your endocrine system, which include adrenal glands, ovaries, and testes, your gastrointestinal function, your liver, your gallbladder function, growth and sex hormones, which are all cholesterol based, fat burning, your body's ability to metabolize fat, insulin and glucose metabolism, healthy cholesterol levels, and proper stomach acid. Each one of these systems depends on proper thyroid function. The main point that I want you to understand is the thyroid is not an isolated standalone organ. This is most likely the model that you've been sold on up to this point from your HMO PPO experience. I know I've stated it numerous times before, and I'll say it again and again. In order to improve and restore function to your thyroid, you must look at it from the accurate perspective that it interacts and depends on every other system in your body. Okay, before I describe the 6 different patterns of thyroid dysfunction, I want to describe the leading cause of low thyroid in the United States today. You will be surprised to know that it is in fact not even a thyroid problem. It's an autoimmune disease. The #1 cause of low thyroid in the United States is an autoimmune disease known as Hashimoto's thyroiditis. It accounts for between 80 and 90% of all cases of low thyroid in the United States today. And the definitive test is a simple antibody test. These antibody tests are standard for anyone that I consider accepting as a patient. These antibodies are almost never tested for within the HMO PPO environment of care. And the reason is that within that system, it simply does not change the care that you're going to receive. You are still going to get a prescription of thyroid hormone with the goal of getting the lab numbers to look normal, and the underlying cause, which again is not a thyroid problem but an autoimmune problem, will most likely never even be brought to your attention. Hashimoto's autoimmune thyroiditis is where your immune system has turned on you, has mistaken your thyroid as foreign tissue and is attacking it. And leaving Hashimoto's unaddressed is dangerous, as it has a tendency to develop into similar autoimmune assaults on other tissues and systems. It can move on to target and attack the parietal cells of the stomach and start to destroy the cells responsible for absorbing vitamin B12. This is known as pernicious anemia. It can move on to and target the cells of the pancreas, which would produce type 1 diabetes type of symptoms. When the immune system attacks the myelin sheathing of the central nervous system, this is known as multiple sclerosis. Leading up to that, a person might experience something like peripheral neuropathy. The immune system can then move on to target a part of the brain called the cerebellum, and one would experience dizziness, vertigo, or balance type symptoms, and eventually a condition known as cerebellar ataxia. So it's very important that the cause to your thyroid problem is addressed and not just have medication thrown at it without understanding and addressing the underlying cause. Okay, let's move on to the 6 patterns of thyroid dysfunction. Now, the first pattern is where the thyroid is truly dysfunctional. There's a legitimate problem with the thyroid gland itself, and this is the only pattern of low thyroid which can be effectively managed with thyroid replacement hormone, unless it's autoimmune Hashimoto's thyroiditis. Then, if you remember, it's an immune system issue and it needs to be addressed very, very specifically. The second pattern is low thyroid due to a poor functioning pituitary gland. Now, the pituitary gland itself is what releases thyroid stimulating hormone to act on the thyroid gland to produce T4 and T3. This pattern has primary causes and must be examined and addressed. Some of the primary causes include an active stress response. Now, this is almost universal in the United States with our busy lifestyle, our poor diet, not enough sleep, high carbohydrate diet, too much caffeine, chronic inflammation, and occult infections. Some or all of these factors lead to adrenal exhaustion, which actually depresses thyroid function. Next, postpartum. Pregnancy amplifies the demands on every hormonal system and keeps the pituitary gland busy non-stop through pregnancy. Also, many women enter into pregnancy in some state of adrenal stress. Next, inappropriate use of thyroid hormones. This is actually quite interesting. Many people are prescribed thyroid medication even when lab tests show normal. Commonly, the patient feels better, but they're actually flooding their system with unnecessary hormone, and their cells develop a resistance to it. Once this resistance occurs, then symptoms return. Third is thyroid underconversion. Now, in healthy thyroid function, the thyroid makes two forms of thyroid hormone, T3 and T4. 93% of what the thyroid makes is T4, which is inactive. The other 7% is T3. T4 being inactive means that it doesn't change metabolism. In order for the thyroid hormone to do its job, it needs to be converted into T3, which is the active form. Underconversion is where not enough T4 is converted into T3. Two things that cause this can be elevated cortisol levels due to stress and chronic inflammation from occult infections. These would be things like viral, bacterial, or mold proliferation in the gut, as well as intestinal parasites. Fourth is thyroid overconversion. In this pattern, there's too much T4 being converted into T3, and just the opposite of the last example that I gave. The fifth pattern is commonly associated with women who are exposed to too much estrogen. And usually this is through oral contraceptives or estrogen replacement therapy. It's called thyroid binding globulin elevation. So let me explain this. Most thyroid hormone doesn't just freely float around the bloodstream. It has to be transported by a certain protein that it binds to. This protein is known as thyroid binding globulin. So it's helpful to think of these little binding globulins, these little proteins, kind of like a taxi cab that the thyroid hormone hitches a ride with in order to get around the body. When there's too much of this binding globulin, too many taxis, it creates too little thyroid hormone available to interact with cells. And the sixth pattern is another stress-related pattern, and it takes place at the cellular level. In this pattern, the pituitary gland and the thyroid gland, they're working fine. They're making the right amounts of hormones, but the hormones are not actually getting into the cells to take effect. High cortisol levels due to stress, chronic stress, cause the cells to become resistant to the thyroid hormone. Now, this is enough to cause symptoms of low thyroid. So hopefully you can begin to see why such limited testing in today's standard of care does not provide nearly enough information for any healthcare practitioner to clearly and accurately understand the cause of your thyroid problem. Now remember, the standard tests are TSH and sometimes T4. Let me share with you the level of thyroid testing available to truly evaluate the cause of a thyroid problem. There's TSH, which is released by the pituitary gland in order to stimulate the thyroid to produce thyroid hormone. Free T4. Total T4, which is both bound and unbound T4 levels. Free thyroxine index. Free T3. T3 uptake. Reverse T3. Thyroid binding globulin levels. Thyroid antibodies, which are thyroid peroxidase and thyroglobulin. That's 10 different thyroid tests which are available to accurately understand what is causing your thyroid problem. Information from this level of testing allows a healthcare practitioner the ability to specifically identify which pattern or patterns a person's thyroid dysfunction is coming from. To do everything necessary to functionally manage a person's thyroid problem simply costs more than your insurance company is willing to pay out for you. If you think that the purpose of your health insurance is to ensure your optimal health, I encourage you to examine your expectations of your insurance company. It is a common assumption that we are insuring our health, but it's not the intention nor the purpose of an insurance company to bring you to optimum health levels. Their interest, again, is first and foremost fiduciary, to make a profit. If the insurance companies can get away with ordering only 1 or 2 tests, they will, and they do, and it's better for their bottom line. But it costs you in terms of quality of life. The next category that needs to be addressed in a functional approach to the thyroid is neurological. Since every function of every system in the body depends on the nervous system, it becomes essential to evaluate and correct, or at least improve, any dysfunction that is discovered. Every thyroid disorder will have a neurologic component to it. At the most basic and fundamental level, all brain and nerve tissue need 2 things in order to function. These are fuel and activation. Now, fuel comes in the form of oxygen, glucose, and fats. How does one know if there are adequate levels of fuel available for the brain and nervous tissue? Of course, the answer is proper testing. Now, we already covered testing for glucose and fats in the metabolic portion of this video, so that leaves oxygen. We use pulse oximetry and perfusion index to see just how much oxygen you have available for metabolism in your tissues. This is most always found at less than optimum levels, and we administer oxygen therapy as a part of our brain-based therapy. We all know that the brain is divided into 2 hemispheres, a left side and a right side. We even refer to certain activities as being more left brain or more right brain. We also understand that different functions take place in different areas of the brain and along different pathways. There are another 2 divisions of the nervous system called volitional and autonomic. Now, volitional means voluntary. For example, we would have a thought to pick up a ball and throw it. And through a conscious thought, we would go ahead and carry out that activity. On the other hand, we have processes that are automatic, and we don't have to think about. For example, right now your heart is beating without you thinking about it. Your liver is carrying out constant chemical processes. Your spleen is ensuring that your red blood cells are optimum shape and size. You may not be aware or even understand exactly what your spleen or liver does, but you don't need to, because your autonomic or automatic nervous system does. So your entire thyroid system is run via the autonomic division of your nervous system. In other words, you don't have to think about your thyroid function. It happens automatically all the time. And here's why it's essential for anyone with a thyroid problem to have a functional neurologic evaluation. If you remember learning how to drive a car for the first time, how all of the coordinated movements and the sequence of activities were kind of clumsy and awkward at first, then as you practiced over time and repetition, the activity of driving became more fluid and kind of second nature to you. Well, this transition from clumsy and awkward to fluid and automatic happens because new neurologic connections and pathways are made throughout repetition over time, and these pathways become developed and deeply ingrained in us, in our brains. We also have similar pathways for our autonomic or automatic function, our thyroid function. And when this system is healthy, the brain patterns and firing becomes integrated into us. But when your thyroid function is not healthy, it can show up in your neurology. And the longer it functions in an unhealthy way, the stronger our brain learns those unhealthy pathways. So in our functional neurological exam, we test for overfiring of the brain, we test for underfiring of the brain, either the left or right hemisphere, and brain weakness in brain expression. Again, we find what's working and we leave that alone. We find out what's not working and improve function with brain-based therapies. And our third approach is, of course, structural, as I mentioned before, and included in an evaluation is a comprehensive examination of the spine where we're looking for any spinal dysfunction, weakness, or areas that could be contributing to a lack of optimum health. If x-rays are necessary, those are often taken. Understanding the cause of your thyroid problem requires nothing less than taking the information from these 3 approaches and combining them to get an accurate view of the cause of your thyroid condition so that you can change your life. You've just gained quite a bit of information and hopefully a deeper understanding of your thyroid and its relationship with the rest of your body. As I described at the beginning of this video, If this information makes sense to you, that's fantastic. But know that the information alone does not produce results. The changes in your health that you are seeking require action. I'm Dr. Brian Thomason. It has been my great pleasure to share this perspective on health with you. If I can be of any further help, please feel free to contact my office at 925-407-0888 or direct any questions that you have to my email at askdrthomason@balancemythyroid.com.